Welcome back, Devine-inspired care family. So glad you could join us again. Ever wondered what could be a significant adversary within the realm of oncological diseases? The answer is esophageal cancer. Esophageal cancer is a malignancy that strikes the esophagus, the tube through which food journeys through. It is a cancer that's found anywhere in the esophagus, sometimes called the gullet or food pipe. The esophagus connects your mouth to your stomach. It mainly affects people in their 60s and 70s and is more common in men than women. Barrett's esophagus. Barrett's esophagus is a condition where some of the cells in your esophagus grow abnormally. If you have Barrett's esophagus, you're slightly more likely to get esophageal cancer. But this is not common. It's sometimes called a precancerous condition. Barrett's esophagus often does not have any symptoms, but you may have symptoms of indigestion and heartburn. Now that we know what esophageal cancer is, let's dive into medical attention. You have problems swallowing. You've lost a noticeable amount of weight. You have heartburn most days that lasts for 3 weeks or more. You have symptoms of esophageal cancer that get worse. You have a condition that causes digestion symptoms and they're not getting better with your usual treatments. Seek urgent medical help if you're being sick for more than 2 days, your poo is black or dark red. You have symptoms of esophageal cancer you're worried about, but are not sure where to get help. It's not always clear what causes esophageal cancer. Anyone can get it, but you might be more at risk if you are over the age of 75. It's not very common in people under 45. If you are a man, have certain conditions, such as long-term severe acid reflux, gastroesophageal reflux disease, or Barrett's esophagus. Many esophageal cancers are also linked to lifestyle. Lifestyle choices like smoking and alcohol consumption are common risk factors for both types of esophageal cancer, highlighting the importance of making healthy choices for our overall well-being. But remember, having these risk factors doesn't mean you'll definitely develop esophageal cancer. They simply increase the likelihood, and understanding them can guide us towards a healthier lifestyle and prompt us to seek regular medical checkups. The symptoms of esophageal cancer may be slow to appear but progressively worsen. This cancer has some telltale signs that we should all be aware of. Difficulty swallowing, known as dysphagia, is a hallmark symptom of this disease. It usually evolves from trouble swallowing solids to liquids as the cancer grows and the esophagus narrows. If you have another condition, such as gastroesophageal reflux disease, you may get symptoms like these regularly. Then there's regurgitation of undigested food. This isn't just discomfort or heartburn. We're talking about food coming back up shortly after eating, often in large amounts and undigested. Weight loss, which might initially seem like a boon to some when unexplained, is a cause for concern. If you're shedding pounds without trying, it could be a sign that your body isn't getting the nutrients it needs because food isn't making its way down the esophagus properly. Anemia, a condition marked by a deficiency of red cells or of hemoglobin in the blood, can also be a symptom. Feeling tired all the time or noticing other signs of anemia, such as paleness, should not be overlooked. In more severe cases, symptoms such as coughing and hoarseness of voice may emerge, pointing to possible invasion or compression of adjacent structures by the cancer. Black poo or coughing up blood are causes for concerns and such be treated as an emergency, although these are uncommon. These symptoms don't necessarily mean you have esophageal cancer, but they are signals that something isn't right. If you notice these signs, it's important to listen to your body and consult with a healthcare professional. Understanding the symptoms is key, but how do doctors diagnose this disease? Diagnosis of esophageal cancer involves a combination of several techniques. Esophageal cancer, like any other disease, needs to be accurately diagnosed to determine the best course of treatment. A key player in this process is the technique known as endoscopy. An endoscope, a flexible tube with a light and camera attached to it, is used to examine the esophagus. This procedure gives doctors a close-up view of the esophagus, allowing them to spot any abnormalities or changes. But observing the esophagus isn't enough. To confirm a diagnosis of esophageal cancer, doctors often need to take a biopsy. This involves removing a small piece of tissue from the esophagus, which is then examined under a microscope to check for cancer cells. However, endoscopy and biopsy are not the only tools in the diagnostic toolbox. There are other methods that doctors can use to get a better understanding of the situation. One of these is a barium swallow study. In this procedure, the patient swallows a liquid containing barium, which coats the lining of the esophagus. This makes it easier to see the esophagus on an X-ray and helps highlight any abnormal growths or changes. Another useful tool is endoscopic ultrasound. This combines endoscopy with ultrasound to create detailed images of the esophagus. It's a bit like having a super-powered magnifying glass that not only lets you see the surface, but also what's happening beneath it. And then there are imaging techniques like CT scans, which can provide a more detailed view of the esophagus and surrounding structures. These can be particularly useful in looking for signs that the cancer has spread beyond the esophagus, a process known as metastasis. These diagnostic tools are like detectives, each with their own special skills, working together to solve the mystery of what's happening in the esophagus. Diagnosis is the first step towards treatment. So what are these treatment options? Treatment of esophageal cancer depends largely on the stage of the disease. This is where therapeutic strategies come into play. Let's start with early-stage cancers. These might be amenable to endoscopic resection. This is a process where the doctor uses a scope to remove cancerous or other abnormal tissues. It's like a targeted strike, right at the heart of the problem. If the cancer has advanced, it necessitates surgical intervention. This could involve removing part of your esophagus, your lymph nodes, even part of your stomach. It sounds daunting, but remember, this is about taking the fight to the cancer, not letting it dictate the terms. Often surgery is combined with other therapies. Chemotherapy, for example, uses drugs to kill cancer cells. It's a systemic approach. Then there's radiation therapy, which uses high-energy rays to destroy cancer cells. Imagine it as a sniper, taking out the enemy from a distance. Sometimes chemotherapy and radiation therapy are used together in what's known as chemoradiation. It's like a 1-2 punch against the disease. However, in cases where the cancer has spread too far, the focus shifts to palliative care. This isn't about giving up the fight, far from it. It's about improving quality of life, managing symptoms, and providing relief. It's about making every moment count and ensuring the best possible quality of life, no matter the circumstances. Despite its formidable prognosis, the fight against esophageal cancer continues, emphasizing the importance of early detection and comprehensive treatment strategies. There's a whole army of treatments, each with a unique role to play, all with one goal in mind: to beat esophageal cancer. And with every step we take, every bit of progress we make, we're getting closer to turning that goal into a reality. We hope you found this video informative and enlightening. The journey through understanding and battling esophageal cancer is a complex one, and we're here to help shed light on these critical health topics. If you found value in this content, we encourage you to like, share, and subscribe to our channel. Not only does this support us, but it also helps to spread awareness about this important issue. If you have any questions or if there's a specific topic you'd like to see us cover in future videos, please don't hesitate to leave a comment. We value your feedback and are always eager to provide the information you're seeking. Remember, every like, share, and comment helps us in our mission to spread awareness about important health topics. So don't forget to engage. Together we can make a difference. Stay tuned for more enlightening content, and until next time, stay informed and stay healthy.